I've said before that there is expense and there is a lack of perceived value. A car is expensive, but people see the value and they buy it. On the other hand, as you said, some people may say £1 for a can of Coke is expensive. I can get it for 59 pence from one of the supermarkets. And that difference in price will make them buy from a different place. I can't change people's level of value perception, and there has to be a certain level of dental knowledge and education on the part of the patient to appreciate what we do and understand why things cost what they do. And I also compare it to other things. I compare it to what we're charged for the services that are provided to us, which seem to go up at a pretty steady rate every year. But I do a lecture on fee setting to make people understand what you need to earn during your career to actually live, to actually be able to, meet the cost of living and live the kind of lifestyle that you want to live. And when you break it down, if you're practicing for, say, 40 years, you have to make a certain amount of money. And the more that we are squeezed in practice by overheads going up for the services that we provide, then our costs will have to go up too. So the question you should ask is, am I expensive? Or is just the environment that we work in and the facilities we provide a significant part of that cost? In the UK, a vast amount of money of discretionary spending is available to our patients. If I said to you that the total amount of money spent on dentistry is somewhere in the region of about £8 billion a year across the population, it sounds like a lot of money, but it's roughly about £115 per head. Now, £115 per head covers about 10 minutes of my overheads. So if you start thinking about the actual cost of doing quality dentistry, then across the population is underinvesting grossly. And I know there is a big complaint about the lack of NHS dentistry. It's just not possible to provide because it's expensive to provide, and the remuneration for the NHS items of treatment is just inadequate, and the government is not providing enough money. So a lot of dentists are having to go private. So when you say I'm expensive, it's really about saying, is it I'm expensive, or is it you just don't wish to spend money on dentistry? The same people who say that I'm expensive will say we'll spend 50 billion a year on cigarettes and alcohol. They'll spend 30 billion a year on gambling. They spend 10 billion a year on Primark. It's not the lack of money in the population. It's a lack of people who value quality dental care is not high in this country. And I think that when you get to a certain threshold and you require work that is done that needs to be of a very high quality and require a very good level of knowledge and experience, you have to realize that comes with a cost. So, as I said before, we're expensive to some. If you really, really can't afford us and you don't have money to spare to spend on dentistry, I understand. But on the other hand, we can also prevent disease just by regular hygiene visits and checkups. Even if you don't have treatment, we can stop you getting worse. But if you really want something done that is high-end, then yes, it's going to have a cost for us as well as for you. So it really is about your philosophy. I think it's about how much you value what we do and how important your teeth are to you and how much a comfortable, being able to eat comfortably and look presentable and not worry about your teeth is to you. If it's not important to you, it will seem expensive. If it is important to you, it's peanuts.